Welcome back, everyone. We're discussing addiction of sorts. We're talking about alcoholism, the disease alcoholism, and we're going to carry on with Dr. Sadaqat Ali, who's still with us, and we're going to find out a little bit more about this.
Sir, we were coming across in our research something called CAGE, C-A-G-E. What does that mean?
That is a CAGE questionnaire we use to diagnose at a family level whether somebody is just drinking or he's suffering from alcoholism.
All right, okay. Can you tell us?
So the CAGE questionnaire is C-A-G-E. If there is a question of cutting down alcohol, the C stands for that, cutting down.
Can they or not?
Can they or not? In fact, nobody cuts down alcohol, because if you try to cut it down, you can do it temporarily, but then it strikes back like a rattlesnake. And A stands for annoyance. You should be actually pleased after drinking, but if you become annoyed, and if it is a little more than annoyance, you become irritable and nothing's right, you become rude also, and you strike at people, then it is more than an annoyance. So A stands for annoyance, which can be anger also. And the third is G, and it stands for guilt. If somebody expresses guilt after drinking, and he says that he will not drink again, and says very, very big words about it, then it is also an indication of alcoholism. The fourth is E. E stands for eye-opener use of alcohol. If somebody starts using alcohol in the morning, that means the toxin is still there in the body, and the toxin is giving him the hangover. That hangover is then again treated with alcohol, because experience tells him that alcohol treats its hangover best. Alcohol overshadows the toxin for a while, but later on it produces more alcohol, so the vicious circle goes on. So this CAGE question here, if you look at it, and if you look at your loved one who is suffering from alcoholism, it will be clear to you what kind of disorder he is having.
But sir, you were mentioning during the break that alcoholism is one of those, again like diabetes, which gives rise to even more diseases. And you said around 300?
There are two disease generators in the world. One is diabetes, it generates lot of diseases. And the other is alcoholism. It generates 324 recognizable diseases, and these secondary diseases cannot be treated until you treat the primary disease itself.
The base, the problem, the source of the problem.
So it's a very great problem that people have lot of diseases, they go to the doctors, and doctors start treating the secondary disease without looking at the primary disease. Just formally they just say that please cut down your alcohol, and he says that I'm already cutting it down.
But you know, the C. So what about withdrawal? What is withdrawal, and what are its symptoms, and what does it mean when you are in withdrawal?
And DTs that are attached to withdrawal.
Withdrawal symptoms occur to people who drink heavily and are alcoholics, and then they suddenly stop cold turkey. So if somebody stops alcohol like this, he has lot of symptomatology, he has aches and pains, he has shakes, he has tremors, and he has all kinds of symptoms. His blood pressure goes high, and he has insomnia, he has all kinds of problems. But in a treatment setting, nothing like this happens, and people go through this stage of withdrawal syndrome very, very smoothly and comfortably.
All right.
The important thing is that one serious danger is there in going cold turkey, and that is delirium tremens.
Yeah, the DTs.
The DTs, the famous DTs, where the alcoholics start seeing yellow elephants. Nobody knows why they look at the yellow elephants. They always say that they are seeing yellow elephants. Once an alcoholic starts seeing yellow elephants, it becomes a serious emergency. So people should not try stopping alcohol cold turkey. It is a futile effort, and it is counterproductive. If you start quitting alcohol a few times and then you fail, then ultimately you start believing that it is not possible to quit alcohol.
So you should seek proper help.
Yes,
that is, admit yourself in a rehabilitation center.
Yes, I agree 100%.
All right.
Because it's managed, it needs to be managed properly.
Sir, in that regard, what is it like to live with an alcoholic? What happens to the family?
It is horrible and terrible experience.
As is very obvious, but
if you think that you are living in a household where floors and walls are shaking and moving all the time, then you can very well understand what it is like to live with an alcoholic. You know, children are living in the same household and they are looking at 5 fathers. The one who is a very, very affectionate father before drinking, then the drinking starts, then he is a different father, then drinking progresses, then he's a third father who's angry, who's yelling at him, who's saying nonsense things to him, and then there is a fourth father who's absolutely paranoid and who doesn't want to see any loved one around, and then there is a fifth father who is passed out and lying on the floor like a heap of clay.
So I think that was so well put, and it's also not just for the children.
No,
think about
the wives, the
and the
mothers,
and
fathers, and
You can just imagine a wife
families.
who needs to pick up his husband who's heavier than her normally, and she has to take him to the bed every night. And
that's simple. What about if he needs a loo or something? Then what do? I mean, that's a simple bit.
I think spouse of an alcoholic cannot sleep.
It's a nightmare.
There is insomnia, there is sleep disturbance all the time because she's worried sick.
Number one, where is he? Is that
sometimes she just awakens in the middle of the night and the husband is not there, and she starts finding the husband and he's in the kitchen doing something there, then he is in the bathroom, then he is in the balcony, and she is worried sick. And sometimes she is sick and tired of being sick and tired.
Yes, this is very true. It wears you out.
And we put it as shadow alcoholism.
It is very
It is the shadow of the alcoholism on the family members. We call it codependence also. And this is a disease in its own right.
So then family members will also need therapy? If somebody has realized...
Presumably they would need some kind, some kind of counseling, some kind of management system to deal with this. Otherwise, how do you deal with this? Living with this is a nightmare.
Well, basically, the treatment starts with the family. And we do first thing first. We treat the family members.
How?
And they need a lot of counseling. They need to understand the disease process of alcoholism. So they get rid of that resentment that this person who is a loved one is hurting them.
Shouldn't they first identify that the problem exists? Because what if they are also in denial?
The family is in denial for a long time because alcoholics are magicians. They can distort and they can distract the facts of the family.
Very negative
And they can linger on with the drinking, promising every day. So there is a love-hate relationship with the family. But one day the pain is too much and family starts realizing that there is a real problem, and then they contact a professional counselor. They try to understand the disease process. And ultimately there are a lot of ways we can help a family and a person who is suffering from alcoholism.
And also there's a huge sort of increase in binge drinking. You know, what teenagers call binge drinking, drinking till you're comatose. And this, again, this is a global phenomenon,
No, basically it is the same thing. It is a layman's term. Binge drinking is a layman's term. Actually, alcoholism has two aspects. There are two sides to this coin. One is the drunkenness, the other is the huge quantities people consume. And these two aspects of alcohol, when combined together, give a variety of alcoholism. So that is why we call it as alcoholism includes alcoholisms.
Okay.
So there is a lot of variety.
This is another distinction that we need to establish. So this is good.
What about legalizing it? Say, for example, in a country which does not have alcohol as a legal substance that is available over the counter, do you think that would ever affect this 10% of the population and actually reduce this 10%?
Legalization does not have a positive effect, and also if you prohibit it, it does not have any positive effect.
Either way.
It does not matter either way. If somebody is to drink, he will make sure that he gets his drink. But people have tried prohibition all over the world.
Does that work?
No, it does not work. In America, there was prohibition on alcohol from 1920 to 1932, and it didn't work out well. So that is why they legalized it again.
All right. Okay.
So it will not work.
Sir, I think that is. I think we'll have to take that up in another show altogether. Thank you so much for being with us today. It was a very informative discussion, and it was difficult for you, but you broke it down very easily for all of us and the audience out there, such that we could actually get to the essence of the problem. And I think, Amina, we can safely say that today we managed to cover a topic which is not supposed to be discussed on TV.
Well, I don't know. I mean, it's an issue. It's an illness. It's a disease like any other disease that you have in the world. We've talked about many other illnesses. This is just another illness that needs addressing. Thank you very much, Dr. Sadaqat. That was great.
And thank you for actually writing in to us, because this show was prompted by emails, and it wasn't just one email, it was loads of emails that we got from you people that you enjoyed, and you were very informed by the discussion we had on the drug addiction show. So can we have a follow-up on that?
And this is yet another addiction, and it's a disease and illness. Don't forget that this is an illness. It's a disease. You need to see a doctor.
We really need to take a break, so don't go anywhere.